Up to 11% of the adult population suffer with the intestinal disorder irritable bowel syndrome. Symptoms of IBS include abdominal pain, bloating, and alternating diarrhea and constipation. Currently, doctors diagnose IBS by a process of elimination by ruling out all other medical conditions, as there is no medical test that can confirm the diagnosis. The Noisy Guts project has changed this, however, by developing a non-invasive way of diagnosing and monitoring irritable bowel syndrome.
The great advantage of a non-invasive test for a common disease like irritable bowel is that there's no threshold to have it done. You can do it on adults and children. You can repeat the test, and you can then perhaps use it to guide therapy. So you might want to change your diet and then see if it's having any beneficial effect or not. The beautiful thing about it, it's non-invasive, so it's not like there's any risk to it.
A series of microphones encased in a belt is worn on the patient's stomach and records the sounds that are present. The data that is collected is analysed by the Noisy Guts patented software, which detects particular patterns, frequencies and signatures which correlate with IBS.
So we have two products. We have a diagnostic test and a monitoring service. So with the diagnostic test, a patient might go along to a GP having symptoms similar to IBS, but not quite sure what it is. So the GP would then refer you to a pathology centre to go and have the diagnostic test. You would wear the belt for about 2 hours, and then the result just comes straight to your phone. If you're looking for a monitoring service because you'd like to try a gluten-free diet or a new medication, or perhaps even the FODMAP diet, you could rent or buy our product from your community pharmacy. So we could track your symptoms so that you had some information, some real hard data, so that when you're trying to work out which treatment is best for you, you're making those decisions based on good scientific data.